Hello, my name is Arturo Cervantes. I'm a member of this Global Violence Prevention Forum, and it's an honor to be here today. I come from the National Institute for Educational Evaluation in Mexico, and I'm very happy to be moderating this panel. What we intend to do is, this millennium has seen an incredible progress in multimedia and information technology, how it's influencing public health practitioners and public health research at unprecedented and very novel ways in violence prevention field. So in this panel, we are going to explore how information technology, how media and communications interact, and how they might influence perceptions and cultural norms for violence, and ways to harness this technology for positive changes in violence prevention. I will give a very brief 5-minute introduction, and this topic is not new to the forum. On a previous forum, we discussed communications and technology for violence prevention and learned a lot about this field. So in addressing social and cultural norms, just based on the fact that this society is based on information and on technology, is very important. So literacy in media, literacy in communications and information technology will become critical for us as we move forward. We all know that the use of information technology disrupts the traditional flows of information and the traditional hierarchies with a transformational impact on our society. So information, technology, communications, and media, if they play such a powerful role in spreading messages across populations, in reaching isolated and vulnerable people, how can we use that to move forward? Networks, for example, are used to maximize value and power, and by breaking down the barriers and the silos that are traditionally occurring in societies, technology opens new opportunities. However, I think we have to be keen for the need for an evidence base concerning the effectiveness of traditional technology and communications and media for violence prevention. This can be measured. The speed of information technology, the speed at which communications and media are developing, renders traditional methods for evaluation useless. However, new technologies provide new opportunities for collecting data, for obtaining data in real time, and getting out of this big data paradigm much more information that could also help us to prevent violence. So I'm looking forward to this dialogue. And I'm sure we will understand that there can be advantages and also dangers in the use of communications and information technology and in the use of media in the field of violence prevention. I'm certain that we will all benefit from this discussion, the field will benefit, and I am looking forward to your participation. Please, it is my pleasure to introduce 3 speakers. I will not read their bios. You have this in the speaker bio sketches in the green folder. You can read more about the work of Suruchi Sood. Thank you for being with us. Lori Dorfman from Berkeley Media Studies Lab or Group, and Malika Dut, also founder and president of Breakthrough. So thank you very much. Please accompany me in welcoming you. And we will start immediately, please, with our first speaker, Suruchi Sood. Please join me.
Thank you, Arturo. Let me make sure I understand how this works. Did it work? Yes. All right. Good afternoon, everybody. It's a pleasure to be here. I'm already learning a lot. I feel like my head's going to explode by this evening. My name is Suruchi Sood, and I've been working in child protection For about 15 years, child marriage in Bangladesh and in India, worked in Jamaica on a positive parenting intervention, and recently was involved in Sierra Leone in trying out communication approaches to help implement a policy. So the policy had already been created. It's a child welfare policy. Well, how do you implement it? How do you promote it? So those are the kinds of things I've been working on. 20 years in entertainment education. So to hear today a stellar presence say, work on soap operas just was so validating. I can't even tell you. I can't wait to go back and tell everybody, let's all do soap operas, because that's what we've been doing for a long, long time. Today, we're going to be talking about a project that I've been doing with UNICEF for 3 years, and this is a systematic review of C4D approaches, and by C4D we mean communication for development approaches to address violence against children. I am talking about violence against children, but some of the issues that we've uncovered applies across the board to different kinds of violence. Because I always run out of time, I want to first start with acknowledging the fact that I have wonderful collaborators. This work wouldn't have been possible without funding from UNICEF, and I have a whole army of graduate research assistants working with me on this systematic review. So I'm just a spokesperson, if you will. The context against which we started this study came from the general comment number 13 of the Secretary General's study on violence against children, which stated, no violence against children is justifiable. All violence against children is preventable. So that's the context we started with. We asked a really, really simple research question. What are the effects of communication for development approaches to address violence against children? Of course, you start simple, and then because I'm an academic, we complicate things. So we decided, okay, well, what are the C4D approaches or communication for development approaches that we want to look at? And suddenly we had a whole Pandora's box of approaches. There's communication for development, there's behavior change communication, there's social change communication, there's advocacy, there's social mobilization, there's community mobilization, there's participatory communication, communication campaigns, strategic communication, media campaigns, and of course, social media and interactive communication technologies. We focus mostly on children, so we used a variety of keywords. This is how we did the systematic review. And when we looked at violence against children, it's not one issue. It's 13 different things that we needed to be looking at. So we have gender-based violence, corporal punishment, bullying, gang violence, sexual abuse, sexual exploitation, trafficking, child labor. And so it's a really, really long list. And this very soon became fairly complicated. We looked at 5 search engines, both academic and non-academic in nature. We ended up with over 80,000 hits through all of the key terms that we analyzed. This is why I have an army of graduate assistants working on this. We looked at about close to 2,000 articles, abstracts. We selected 533. And our final database, we have a giant database of 302 manuscripts that we've coded. All of these manuscripts use one of these approaches. They address children, and they're looking at one of these issues or more. So that's what the sort of background to this is. In this presentation, I want to go over some key findings and some points to consider as we think about global interventions. This work has taken us 3 years. We have a 200-page report, a 20-page report, 3 manuscripts in various stages, all kinds of good stuff going on. Results that we don't even know what to do with. I'm obviously not going to go over everything for you, so I've selected a few things that I think might resonate with this audience as we're talking about social norms. So first, I want to talk about conceptual frameworks and levels of influence. What did we learn? 50% of the manuscripts that we reviewed do not reference a conceptual model. And what this means is that they're losing out on 2 really important things here. what conceptual models do is they explain to us where are our audiences in the stages of change, so we can move them along the continuum. So to give you two examples, if an individual approves of corporal punishment as the right way to discipline children, then what we have to work at is changing attitudes, and because they are not measurable, maybe personal beliefs that that person holds. Similarly, if a society as a whole supports a harmful traditional practice, let's say child marriage or FGM, what we do is we have to work towards creating a replacement norm. But if we don't know what our conceptual model is, how do we go about doing it? Conceptual models are essentially our theories of change. So in order to use communication approaches, we have to know, well, what do we want our communication approaches to do, right? And so we know communication can change knowledge. So for example, people might not know child labor is a problem in their society, right? So we increase knowledge and we use communication to do that. We can use it to change beliefs. So for example, in discrimination against girls, girls eat last, girls eat least. That's an attitude or a belief. We can change that. Or we can talk about changing norms around certain behaviors. Or we can look at networks. So perhaps, well, if you see an incident of violence, who do you report it to, right? So those are the kinds of things that communication can help us do. But like one of my mentors said, if you don't know where you're going, how will you know when you get there? So having that conceptual model is critical. The second thing to consider is this whole notion of level of influence. And what we did was we looked at, are these interventions geared towards individuals or are they geared towards other levels? And what we noticed was 84% of the time, the interventions were geared towards individuals. Now, if social norms really are about what we think others think of us, and if our networks, our referent networks are so critical to social norms, we cannot be doing communication interventions that are looking at us as silos, as individuals whose knowledge needs to be addressed. So that becomes a critical point to keep in mind. So following along the lines, for program implementation, what did we learn? Most of the communication interventions that we looked at were directed towards one group of program participants. Individuals don't live in isolation. Social norms don't operate in isolation. So in order to create environments of change, it's critical that our interventions address communities, address families, and address them through various ways. One of the interesting things we noticed was that oftentimes communication interventions would say, here's our primary audience, here's our secondary audience, here's our tertiary audience. That's great, you've done audience segmentation. But then there was no tailoring of the intervention. And one size doesn't fit all. So if you're going to go through all the effort of segmenting your audiences, for heaven's sake, tailor your interventions for those audiences, right? And carrying right along, can you see I'm on a roll here? Use multiple channels. Right? So if most interventions only used one channel, what we found from our 302 studies, in developing countries, they were more likely to use mass media. And in the US and other developed nations, for lack of a better way of disaggregating the world, they followed the training, the capacity building trajectory. So interventions were done in more institutionalized settings, for example, schools. Right? So the point being that you can use multiple channels to use multiple audiences. Another thing to keep in mind is you can choose multiple channels to address one audience. So one of our findings is youth violence initiatives were likely to be much more successful if they used social media, but then they also used peer mentors, and they also involved parents through, let's say, PTA or other formats, and they used community interventions. So that's really, really critical. Whoa, all right. So in terms of monitoring and evaluation, the weakest link. Hardly any formative research. Only 17% of the articles described any formative research. So really weak on the whole diagnostic element. Process evaluation. We measure how many how many posters are printed, how many radio ads are produced. Does anybody see those hear those radio ads? Does anybody see those posters? We don't really go into that. Seek and ye shall find. We were looking for effective evaluations. So obviously all of our articles, 75% of them talked about impact. From an academic perspective, not particularly robustly designed. And only 24 manuscripts use participatory research methods. Some of the points to ponder, I know I'm repeating myself. Communication is so critical to address emotions, to change how people feel things and how people do things. And that's where the role modeling comes in. So it's really important to use communication to build efficacy, to create dialogue and discussion, to address norms, let it be through maybe communities that come together to denounce harmful practices, and to use it as a tool for advocacy. Really important also from the measurement point of perspective is this notion of the interventions we do really do depend on whether violence against children or violence is a dependent variable or is it an independent variable? Is it something, are there various factors that lead to violence against children? Yes, but if that's the notion we're coming from, we'll design a certain type of intervention. But if we're looking at what does violence against children lead to, our interventions are going to be really different. So it's important to first remember for us, is violence a dependent variable or is it an independent variable? Why and how does gender matter? We've talked about this morning. I won't belabor the point. Female empowerment interventions work. It's important to involve both men and boys. There is information on gender transformative approaches that have been successful, and the importance of meeting the needs of boys and men. Oftentimes across the globe, corporal punishment, child labor, the worst forms of child labor, boys are subject to harsher forms of corporal punishment. So it's really important to not get caught up in violence as a women's issue or a girl's issue. Start early. I know I've been harping about everything that's wrong with the world. There is evidence of early childhood development interventions that work. There is evidence that positive parenting interventions work. There is evidence of family-based programs that work. And there is evidence of generational programs. And by generation, we mean programs that start with infancy, look at maltreatment and neglect at infancy, and then carry through all the way when they're talking about parents and they're talking about grandparents. So we can start creating this culture where boys realize it's not okay and girls realize it's not okay to accept violence. So sort of those long-running programs. Two last slides, scale up promising interventions. I know we've heard this before. There is evidence to show early childhood development programs work, family support programs, intergenerational programs, female empowerment programs, school-based initiatives working with a spectrum of people, with teachers, with students, with peers, with parents, and whole school approaches to bullying. So this is evidence of programs that have worked on smaller scales. The important thing is to scale these up. Of course, it's important to think that, one size obviously will not fit all, so careful planning is important. And to borrow a term from communication literature, the need, I think, is one of transcreation. So you can't translate a program from one community or one culture or one society to another, but you can transcreate programs that have these common elements from different places, and that becomes your scaling up, if you will. And then, of course, cannot emphasize enough the importance of research, because where the world that I come from, if you don't have data, if you can't prove that it worked, nobody cares that it happened, or at least a lot of people I work with don't really care. The importance of formative research, design interventions that are based on audience needs. A process evaluation look beyond just measuring what elements were produced. Weak effects mostly measure things, don't count them. I can't stress that enough. Measure, measure, measure is very different from counting things. Violence against children is complex, so are its measurements. Programs and research should be integrated instead of saying, well, can you come and evaluate this program? It really works great. Just that's what happens a lot. And participatory evaluation, can't stress that enough. Involve your participants in everything, data collection, data analysis. It's fun and it's, that's just what we should be doing. Thank you.